Hello everyone, my name is Tameka Lloyd and I'm a student at the University of Mount Olive Master of Science in Nursing degree program. This short video is an assignment for my MSN degree. I will take a few moments of your time today to explain nurse theorist Madeline Leininger's cultural care theory of diversity and universality, which is also taught in the Nursing 455 course titled Nursing Theory in the UMO RN to BSN degree program. The goal of this short lecture will be to discuss Leininger's cultural care theory of diversity and universality and how this theory can be applied to everyday practice. Following the completion of this short video, RN to BSN students will be able to 1. Recognize cultural factors in nursing practice. 2. Identify 3 theoretical practice modalities to arrive at culturally congruent care decisions and actions. The purpose of the theory is to explore culturally based care factors that may influence individuals, families, groups, or communities. The goal of the theory is to discover ways to provide culturally congruent care to people of various cultures for health, wellness, illness, or to face death. Nurses must be knowledgeable about cultural factors in the diagnosis and treatment of clients. Cultural factors to consider when providing care are expressions, health illness beliefs, patterns of behavior, caring values, and healthcare practices. Some other factors to consider are the client's language of choice, religion, family support system, educational level and learning preference, social economic status, healthcare rituals, and alternative medicine beliefs. As you can see, these are just a few of the cultural factors to consider, but there's so many more. The 3 theoretical practice modalities for culturally based decisions and actions are as follows. Number 1, cultural care preservation or maintenance. An example of this would be promoting breastfeeding by altering the environment to ensure the breastfeeding mother has access to equipment and a room designed for breastfeeding. Another example would be to provide a room for clients, families, or cultural groups of various religions to pray. Number 2, culture care accommodation or negotiation. An example of this would be accommodating alternative medicine preferences such as herbalists, Chinese methods, and spiritual healers, or negotiating with a Jehovah's Witness that refuses to receive blood transfusions and instead providing them with alternatives. And number 3, culture care repatterning or restructuring. An example would be collaboration through education and wellness programs such as smoking cessation, or educating a client that has been rehospitalized for infections about the importance of completing the full course of antibiotics. This brief lecture met the goal and objectives by discussing Leininger's culture care theory of diversity and universality and how this theory could be used in your everyday practice. This lecture recognized cultural care factors in nursing practice to consider when providing care. Lastly, 3 theoretical practice modalities were identified to assist nurses to arrive at culturally congruent care decisions and actions. Thank you so much for tuning in. Your time and attention today was greatly appreciated. Let me remind you to complete the very short survey, giving me a thumbs up. The survey is provided through the Nursing Student Center, and email it to my professor, Dr. Joy Kiefer, at jkieffer@umo.edu. That's JKIEFFER@umo.edu within the next 3 days. As always, I am wishing you all the best in your RN to BSN degree program. Thank you so much.